days or maybe even weeks later where I started to realize that nothing had happened there but a thought, right? No one had broken in, yet the physiology in my body was exactly the same as if someone had broken in.
Mm.
So it's not the break in that changes your physiology, it's the thought.
All right. Well, Dr. Torelli, thank you so much for joining the podcast, the Darren Well podcast. I'm so glad for you to join us today. So today I'm excited for you to share more about the Gratefully Well model. So you being a cardiologist, you come in from a wellness perspective, a holistic wellness perspective. I'm so excited for you to share more about who you are and what you've been doing in the world to help others live well. So share a little bit more about your background, share a little bit more about your why of why you chose this field and why you're positioning and pivoting into the Gratefully Well model.
Well, thank you. I appreciate the opportunity for us to be on your podcast. I feel very honored. It's been a long journey. So, I graduated from medical school in 1986. So it's going to be 40 years. And I noticed a lot of things, even early on, like at the very end of medical school, I saw a patient. It was literally the last week I was doing a family practice rotation. A beautiful woman came in who was, in her late 30s or early 40s. And she had horrible vomiting, nausea, vomiting, and dry heaving for 3 days. And she was absolutely miserable. We didn't really know what was going on. So she was dehydrated. And so we put her in the hospital and we hydrated her. We ran some tests. And as we were doing that, everything came back normal over about 3 days. She was feeling somewhat better. And I went to discharge her. We didn't find anything. I didn't really know what I was going to, I was going to graduate in 2 days. Know what to use as a diagnosis. A attending physician told me to use viral gastroenteritis, which I was like, I guess I learned that if I have no idea what's going on, we call it a virus.
I'm
And
glad you said that, Mr. Cardiologist.
yeah, and we put itis at the end of it, right? And so, but I sat down to write her discharge instructions and such. And as I was doing that, I was making some small talk and said something corny like, well, we're going to get you home where you can get some real rest because you can't get rest in the hospital, right? And she said, I wish. And I was like, what do you mean you wish? And she says, I wish I could go home and get some rest. And I'm like, well, why can't you? And she said, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down.
And this is real life, what people are dealing with.
And I was flooded at that instant with these conflicting thoughts because it was intuitively obvious to me at that moment why she was sick. It was this overwhelming amount of, I'll call it emotional overwhelm is what I like to call it, right? We would call it stress.
Yeah.
But then that was one thought. Then the next thought was, wait a minute, I'm now finished with my education. I got 2 days left. I'm sure that I'm not going to learn something about this in 2 days. Like I didn't learn anything about this in medical school. And then I was like, well, is it a thing? Is this something? And I said, and then I was like, I have this whole medical school library that is available to me, and I'm not even sure where to go to read about this. And if it is a thing, how do you treat it? And so I was totally confused. And I said it was a busy time because I had to move up to Cleveland. I was in Florida in medical school. And, so I didn't, but that patient stayed with me. And then over the years, through my training in internal medicine and then cardiology, and then as I went out into practice, I saw these patients over and over again. Patients where it started to become clear that there were a lot of patients. And I would say, if you look at visits to doctors' offices, not maybe if you forget the ER, but if you look at just the doctor's offices, most of the visits, I think patients come in with chronic complaints and we don't ever find a medical explanation for those symptoms, right? Headaches, belly pain, chest pain, back pain, fatigue, that's a common one, right? Muscle aches everywhere. And we give all these, we don't find anything physical. So we give these fancy terms, fancy names, like irritable bowel syndrome, fibromyalgia, migraine headaches, tension headaches with a migrainous component, non-cardiac chest pain, what have you. And then we don't know what else to do. So we use medicines to try to treat these things. But we all recognize, even in the medical field, even in the Western allopathic model, that these are emotionally related, that they're stress related. But yet we don't, we, we in our toolbox of things that we have to treat people, we have, you open up the toolbox, the first tray is tools like procedures, right? Surgeries and things like that. If you take that tray out, the only other thing in the toolbox really is pharmaceuticals. In Western medicine, we don't have anything else in the toolbox, and so it becomes somewhat challenging, right, to know what to do with these patients. And so even though someone comes in with migraine headaches and these are stress related, we give you a medicine to prevent the migraine. We give you a medicine to treat the migraine. If you get the migraine, maybe you're seem depressed. We give you something for depression. Maybe you're not sleeping well. We give you something to help you sleep as well. Maybe you're a little anxious, and so we give you a sedative. And next thing you know, you're on 3, 4, or 5 medicines.
So quick
I have
fixes,
no
but not
problem with the
addressing the
medicine,
issue.
but none of them get to the foundational issue of
Mm,
stress related, and that's what we tend to do. So the gratefully well sort of method, that's what I've termed it now. But historically, what we've done is, try to take a more holistic approach
mm.
to patients' symptoms and patients' illnesses. And when I say holistic, I mean we don't look just at the physical. Yes, the symptoms are physical manifestations, like headaches, right? You got a headache. It's a physical manifestation. You got belly pain. You have irritable bowel. That's a physical manifestation. But we try to look at these mental health, what I like to think of as non-physical aspects of a person, the emotional aspect, mental health, behavioral health, social, cultural, even spiritual sort of aspects, right? Integrate that with the physical, with the treatment that you might be receiving. Like I said, there's nothing wrong necessarily with if you have cancer and you need chemotherapy. We're not saying don't have the chemo. If you have migraine headaches, we're not saying don't take the medicine. Medicines, the treatments are fine, but in addition, try to look at these other components because they're
Holistically. Yeah, that's good. That's good. So that client years ago, that patient years ago, 40 years ago, has inspired you to kind of be curious of like what is the underlying causes of what's really going on. So not even just band-aids, quick fixes, but just really how do we help the person to truly heal and live well? That's
yeah, and I
awesome.
think that's what one of the things that's missing. And Western medicine, we've made incredible technological advances. And like if you would have told me 40 years ago that we would be able to replace an aortic valve through a needle stick without opening someone's chest, I would have said, really? Right. So the technological advances are incredible, but I think where we sort of kick the brick is this issues where we don't find anything physical, where there's no surgery necessary or anything like that. Then sort of what happens in those cases, and the medicines just aren't, they just don't do it right. So you need a more holistic approach or comprehensive approach.
Yeah, yeah. Yeah, so can you share a little bit about the science behind emotions and how the thoughts and our beliefs, how they affect us physically, how they show up in your office as a cardiologist with all these stress issues?
Yeah, I think the easiest way to start to think of this, we don't talk much in our society about the power of beliefs or the power of thoughts, and maybe people start to think of it as being a little airy fairy or woo woo. But if you stop for a second, and this happened to me, a lot of the stuff that I do in my practice comes from my personal sort of experience. But one night I was going to bed. It was late. The family was all asleep, and I laid down and I was falling asleep in that awake, asleep kind of a stage. And I heard a noise downstairs, and I got startled, and it was a strange noise, and not noise I was familiar with. And so when you get startled, the first thing that happens, your heart starts racing a little bit, right? And you wake up, right? And then I had a thought, oh, I wonder if someone broke in. Now my heart's racing faster. My palms are sweaty. If you would have measured my blood pressure would be up. If you measured my heart rate, it would be up. If you measured my sugar, it would actually, sugar goes up, cortisol goes up, and these things, right? And so I stopped and listened, and then I started to have more thoughts. Well, what if it's not one person, it's two people? And what if they broke in and they're going to come upstairs and do these horrible things to me and my family? Those were the thoughts that ran through my head. Well, by this time now, I wouldn't say I was in a full out panic, but my heart was really pounding, and I got up, and I got sort of the nerve up, whatever, went to look and went downstairs, and there was a broom that had fallen, and when it fell, it knocked these two empty boxes down, and that was the noise. And I went, oh.
But the
So
story you're telling yourself is that somebody broke in.
that's exactly right. So I went back upstairs, and now I had everything kind of calm down. But
Yeah.
it wasn't until later, like days or maybe even weeks later, where I started to realize that nothing had happened there but a thought. Right? No one had broken in, yet the physiology in my body was exactly the same as if someone had broken in.
Mm,
So it's not the break-in that changes your physiology; it's the thought.
wow.
Right. And so, and then, and we have, the other, another example would be like, if you get in a relaxed state, close your eyes, and you picture a lemon, and you picture cutting that lemon and biting into that lemon, you will salivate. There's no lemon, right? But the physiology is the same as if you had bitten into the lemon. So these thoughts are very powerful, and so have experienced that life really is probably lived more in the head than it is anywhere else, and we don't really emphasize this enough, I think, in Western medicine. And then you can take it all the way to the placebo effect, which is an effect that we all understand, and where it's taught in medicine. The pharmaceutical companies hate it because it's a nuisance to them, because they have to do research to show that their $500 million drug works better than a sugar pill,
Right.
meaning the sugar pill works, right? But what is the placebo effect? It's an inert substance that works, that helps people feel better. It decreases pain, or sometimes even cures illnesses. What is that about? And it's nothing more than a thought, a belief. It's a belief that you're getting something that is actually decreasing, that's going to decrease the pain, or it's going to do, there's a nocebo effect too, that, where things get worse, like you put a cream on and it's going to give you a rash, and you get a rash, and meanwhile it's an inert cream, right? That would be called the nocebo effect. When we know about these, and we think of them as a nuisance, I think we need to try to amplify the placebo effect personally, right? As opposed to think of it as a nuisance.
Yeah. Yeah. So the power of our mind that can really change our physical symptoms. That's
Yes.
wild. And so I think, if I'm not miscorrect, so heart disease is the number one killer of cause of death in the United States. Is that correct, Mr. Cardiologist?
Yes. So heart disease is very common. It's leading cause of death in men and women over the age of 65. Very prevalent. And there are things about heart disease, obviously, that increase your risk, like high cholesterol and high blood pressure, and diabetes and blood sugar and things like that. But again, we also know that there's a stress component. I use the word stress because that's what's commonly used. I like to think still, I keep saying, I like to think of it as an emotional component to that, right? So and this is evident, but again, these we have medicines to treat high cholesterol. This is the problem in Western medicine. So we're so scientifically based. It's not. I don't want to call it a problem, but a consequence of being so scientifically based. Cholesterol is easy to measure. You say, oh, look, if the cholesterol is higher, the heart disease is higher. So you kind of get that correlation. And look, if we lower the cholesterol, the heart disease goes down. So that's easy to measure. Blood pressure. We know the blood pressure. Look at, if the blood pressure is high, we know that people do worse. And now look, we've got medicines, and we lower the blood pressure, people do better. So those are easy things to measure. Blood sugar is another one, right? But when you talk about stress or emotional sort of issues, or these kind of soft things, they're very difficult to measure. And so we tend, because we're so scientifically based, and in science you have to measure things, those studies are very hard to do. So there's less emphasis on that. And then, because what's stressful to one person may not be stressful to someone else. And so, and then how do you treat that? Again, it's, we always revert to medicines, because in our society, like, people just want a pill for everything. People are unwilling to take some degree of responsibility for their own health care. Right?
Yeah.
They'd rather put all of the emphasis on the physician. The physicians, you wake up in the morning, you have a headache, and you take some medicine, Tylenol or whatever, and it doesn't go away. And maybe the next day it's worse. You make an appointment, you go see your doctor, and you expect him to do two things. You expect him to
To
figure
fix
out what's
it.
going on, and you expect him to fix it, right? And then he gives you a pill, and life goes on. You're sort of happy, right? But people, that's the way our Western medicine model works. It's an illness-based model. It's not a preventive model. It's not a wellness-based model. As we were talking about before, it's people don't wake up in the morning and want to stay well and think about going to the doctor to do that. Even in your wellness visit, your annual visit, the doctor's not there to prevent stuff. The doctor is there to look for things. He's looking at you're doing your mammogram to look for breast cancer, or your prostate screening, or you're looking at checking your blood pressure and your cholesterol. You would say, oh, well, that's to prevent heart disease, but he's still looking for something to basically treat, right? And so that's just the way our Western model tends to function.
Yeah, yeah. And I love that you're trying to put a new spin on that. Not recreating the wheel, but just finding new ways to break the wheel, honestly, because it's not fully working, because it creates this dependence on medicine, which we need medicine, but also we need more than just medicine. We need to treat the whole person.
Got it.
So I
So
love your model.
you don't want to throw the baby out with the bathwater, right? If you
Right.
need, if you have cancer and you need chemotherapy, or you need surgery, or you need to have a heart valve replaced. I'm not saying don't do that, right? Of course, I'm not saying, oh, you don't, there's a lot in the holistic sort of world where people say you don't need the chemotherapy for your cancer. You can take these supplements and do this sort of stuff. It's not what we're talking about here. We're talking about, you know, all of this stuff can be done in conjunction with whatever Western treatment, medical treatment you're receiving.
Yeah, so being wise. I love that you're clearing that up so nobody walks
No,
away with like, hey, throw away your medicine. No, that is not what we're saying
right.
today.
Thank you for that. Yes, no, that's not
Yeah.
what we're saying.
So being wise, being wise. And so, yeah, I'm just so fascinated of just how the mind is driven by and our emotions, how they can drive like our physical symptoms. And so when you think about like CBT techniques or reframing techniques, what are some other ideas of how people can take their mindset and use that in a way to help think themselves well and how to redirect their energy?
So it's a great question. And I think there are a lot of things out there. I use gratitude a lot, which is why this is called Gratefully Well. Gratitude
Yeah.
is a big part of my life. And it overflowed into my practice. And the reason was because when I started to look at gratitude, there's actually literature on gratitude. There is evidence to show the physical and mental health benefits of
Wow.
gratitude. And when I saw that, it wasn't anything I learned in medical school, because I was always looking for things. And so, if I told you, Rita, I said, there's a drug out there or a treatment that helps people recover more quickly from illness and medical procedures, that reduces illness symptoms and pain levels, that enhances immune function and improves sleep quality. And then, in addition to all that, gives you a greater physical health, increased resilience, helps you cope more effectively with stress and feel better about life as a whole, and be more optimistic about the future, and all at the same time, decreasing levels of anxiety and depression. If I told you there was a drug like that, what would you pay for that drug?
I would pay tons of money
You
to
would, right?
not
Because
have
people
all
pay
those
$1,000
issues.
a month for weight loss drugs. What would you pay for that? Like
It's
it's
priceless.
priceless.
Yeah.
That's gratitude. Gratitude, there's
Mm.
evidence to show that gratitude does all of that. And what does gratitude cost? Doesn't cost anything, right? As I looked at the literature, there's a lot of, how do you, again, it's hard to measure. So there's gratitude journaling. It's a wonderful thing. And I'm not saying don't do it, but with gratitude journaling, you have to sit down every day, every morning or night. You have to get your journal out, and you've got to, take some time to write things that you're grateful for, 3 things or 5 things or whatever it is, on a regular basis. It's a great practice. I encourage people to do it. People do it and they say, it doesn't really do much for me. Well, how do you measure the quality of the gratitude, right? It's not necessarily about quantity. It's about the quality. If you laying down at night and you go, oh, shoot, I forgot to do my gratitude journal. You get up real fast. I'm grateful for my family, and I'm grateful that I have a job, that I get paid, and I'm great. And you go, okay, I got it. And you go lay back down. Does that effective? Yeah, maybe. Uh,
Just a little.
you're right. But so what I found, and I found this, told this story in a book I wrote that's available on Amazon, but called Holistic Health Pathways. But in that book, or in that story, what happened was I went. It was a Friday night. It was late. I was tired, and I had to get groceries. I forgot that I didn't have any groceries at home. Anyway, I stopped by the grocery store, and I actually love the grocery store. I love going shopping. I love cooking. I love looking at getting food and everything. So, but I walked in, and it was a Friday night, and it was empty. There was no one in the store. Who goes to the grocery store Friday nights, right? They're all having a good time except for me. So I you first, most grocery stores, you walk into the produce section, right? I walked into the produce section, and I became absolutely overwhelmed with gratitude. Like I looked at this stuff, like the tomato or whatever, and it was like, not only was all of this available to me, which was overwhelming, but I started to think like, wow, like I didn't have to go and get seeds and till the soil and plant the seeds and wait for this thing to grow and weed it and take care of it and wait for the tomato, then go pick it. And before I could get this, it's just available to me. All I have to do is buy it. And look at all of this. And I just became overwhelmed,
Mm,
truly overwhelmed, until I got to the bread section, where then I started bawling because here was all of this bread, 50, 100, I don't know how many kinds of breads there were, right? And I just started thinking, what does it take to make a loaf of bread? Like, I didn't have to plant the wheat, till the soil, take care of all that, harvest the wheat, separate the wheat from the chaff, mill the wheat into flour, right? Bag it, transport the flour to wherever, right? To then like make the bread and make the dough and then bake the bread and then bag it and then put it on trucks to get it to the store where I could buy. I didn't have to do any of that. It was just there, and there was a hundred varieties. And I was like, and then while I was complaining, because I was like, the bread's $4 or $5 a loaf, and I'm like, I'm surprised this isn't like $100 a loaf. When I started to think of all the resources necessary, right, to grow that wheat, and then to mill it and to put it in trucks and all the things that the trucks need. The trucks need tires and maintenance, and it needs drivers and all this sort of. I started to think about all the resources that were necessary to produce this loaf of bread for me to go buy, and I was just overwhelmed. All right, and so I think of that as the quality of gratitude. So I call that the Traceback Method of Gratitude,
mm,
and I like it because gratitude journal, you have to sit down and do it. You can do the traceback method on the fly. So you could be sitting in traffic, you could be at the grocery store in the longest line or the slowest line, because right, wherever it is, and you can find one thing to be grateful for, and then even start tracing that back. So if you're sitting in traffic, right, and you're late, and you're going to be late, and you can beat yourself up for not leaving earlier. You can beat yourself up for no good, right? I'm always late. Why am I always late? Why am I so whatever? And all of that will have negative consequences. That physiology we talked about from those thoughts will all have a negative effect on your body. You're doing yourself harm with those thoughts. You can't change the traffic. The traffic is what it is. And you maybe should have left earlier, but that's beside the point at this point in time, right? As you're sitting in traffic. But you could stop. You're in traffic, so you could take a deep breath. You can close your eyes for a second if you're in bumper to bumper traffic, stop, and you can take one deep breath and say, it's 97 degrees out and my car has air conditioning.
mm.
Oh, thank God I have air conditioning. Or I can listen to
Thank
this.
God I'm in a car, that I have a car.
God, I got a car. I can listen to this Darren Well podcast I heard is like I've been wanting to listen to forever. And I can listen to that. I got time to listen to that, right? And so that doesn't change the fact that you're sitting in traffic, but it changes again your physiology, because as soon as you do that, you go from activating the sympathetic nervous system, right? In the autonomic nervous system, the sympathetic nervous system is going to get you revved up. Where if you're mad and you're angry and you go, why is there always traffic? Why didn't I leave earlier? That's your sympathetic nervous system, and that has a negative consequence. When you relax, you take a breath, you activate your parasympathetic nervous system, which is going to give you more peace, calm you down, calm things down, activates the vagus nerve and things like that. And you didn't change anything as far as the traffic is, but I wouldn't. You're not actually when you do that. It's not surprising when the traffic starts moving. I don't know how that works. They didn't teach me in medical school how the universe works. That kind of stuff does happen, right? And
Yeah.
so that's how I like to use that gratitude traceback method. I call that intentional gratitude, and you can do it on the fly. And I think it's just produces what I like to call awe-inspiring gratitude.
Yeah, that's awesome. I love that traceback method. And so going deeper than just like I'm grateful for my life, my health, my strength, my family, my job. Like those are, as I tell clients, those are like the low hanging fruit.
That's
Like
right.
there's so many more things that you can be really intentional to be grateful for every day. And so say again some of those benefits. I got lost in how much money I could save. And so what are some of the physical and mental health benefits of gratitude? So you talk about lower stress, lower anxiety.
Yes. So we could probably put these in the show notes, right?
Yeah.
So if you look at the literature, the gratitude helps people recover more quickly from illness and medical procedures. It reduces illness symptoms and pain levels, enhances immune function, improves sleep quality. People tend to feel a greater episode of greater physical health. It increases resilience. It helps people cope more effectively with stress. It helps them feel better about life as a whole. They're more optimistic about the future, and it decreases levels of anxiety and depression.
Like, it's just it's a win-win.
Yeah, yeah.
It's a
There's a great
win-win.
book out there by Robert Emmons, who's a professor, psychology professor at the University of California. I think I forget which one, but it's in the University of California system. And he wrote a book called Thanks with an exclamation. It's a little old now, probably 20 plus years old, but I think it's still available. He's got other books as well, but it's a good resource for people to start with.
Yeah, thank you for sharing. So as we start to wrap up, thinking about some additional and maybe it's a summary, but just what are some action steps that people can take? So yeah, you talked about the gratitude journaling, you talked about the trace back method, ways to be intentionally grateful. And so what are some either action steps or some words of wisdom that you have to offer when you think about how we can live well mentally, physically, spiritually? I don't know if I said physically, but all the ways holistically how we can live well and thinking about the gratefully well model, like how does that impact of how we can live better?
Well, I think the important thing is one, the first thing and foremost is you have to be willing to take some level of responsibility for your own health and health care. So, again, we
Ouch.
talked about everything, we put all of the emphasis on the physician or the healthcare provider. You have to be willing to take some responsibility. So, if you have diabetes, as an example, which is a great example, I think you have to. Yes, you may be genetically predisposed to diabetes, but diabetes is a lifestyle issue, right? And so, yes, you may need the medicine, no problem with the medicine. But in addition, right, you need to start moving more. Activity is a big thing in diabetes. You need to lose weight to watch and learn, what to eat and what not to eat. So you just have to, and you don't have to be out running marathons, right?
That's a
Small
gentle walk.
changes have a huge effect in type 2 diabetes, right? And that's number one. You just have to develop this willingness to take some degree of responsibility for your healthcare. And gratefully well, when we talk about, like, I don't use the term exercise, I use activity. You just need to live an
Mm,
active lifestyle. You do not have to be out there running marathons, right? I like to talk about nutrition as opposed to diet. When you use the word diet, everyone thinks about losing weight, weight loss, and stuff. It's about healthy nutrition and lifestyle sort of issues. So that's sort of first and foremost. And then the second thing I think again is starting to recognize the power of thoughts, the power of beliefs. I put that all into the term of mindset and the power that these have physiologically. I think it's true in life in general, but since I'm a physician, I talk about physical health and mental health. And you need to start looking at these are powerful agents in the development of illness and in health as well, or as symptoms. And so that's sort of probably the second thing. And then the third thing is, tools. like I said, there are many tools out there. I use gratitude because it's easy and quick. I have a benefit of the doubt. It's another tool that is I find effective. But then there are other more, let's call them traditional, mental health therapies out there, like cognitive behavioral therapy, dialectic behavioral therapy, many others that you know way better than I do. So I think people need to start to look at some of these. One of the big changes that I've seen in my professional life in the development of these therapies, like in the old days meaning 40 years ago, you went to see a counselor, psychologist, you had talk therapy, psychoanalysis, right? You saw a psychiatrist, you'd get medication. But what's happened over these 40 years is the development of these, and there's tons of them out there. Again, you know them way better than I do, but tons of things out there besides CBT, right, that are very effective for people. And so, yes, see your doctor. Make sure, because again, if you're having symptoms of a headache or belly pain or chest pain, you come to see me, you have chest pain, the first thing you're going to get is an evaluation to make sure you're not having a heart attack, physical evaluation, a traditional sort of thing. Make sure you don't have unstable angina. Make sure that you don't have something that needs to be treated urgently or emergently, right? And then if everything turns out okay, you don't have a brain tumor causing your headaches, you don't have Crohn's disease, you don't have appendicitis, causing your belly pain, you're not having a heart attack or coronary disease causing your chest pain, that's when you can start to integrate these other non-physical sort of aspects and these other tools.
Awesome, awesome. So living well also includes just a lifestyle change. I love the way you made it look very simple.
Yeah, absolutely. Absolutely. So I like to think of it as living gratefully well.
And so as we wrap up today, share more about Gratefully Well. What is it? And then how can people connect with you if they want to know ways to live gratefully well? You talked about a workshop coming up at the end of the month. So share and plug that as well.
So, the idea of Gratefully Well, which is new. Not the idea isn't new. The what I'm doing online is new. So I've been doing this for, let's call it 30 years, as practicing. I'm trying to transform what I did face to face with people into this digital educational online platform, which I call Gratefully Well. So I have a newsletter. It's a free newsletter on Substack.com called Gratefully Well. So I encourage people to go and subscribe to that. I write about this sort of stuff. And then I have a book also that you can get on Amazon. You can look that up, Holistic Health Pathways. That's specifically about the physical and mental health benefits of gratitude. That's what that book is about. And then I'm having a free workshop, which will probably start at the end of the month, probably be 3 or 4 weeks. I'll probably may have a couple of these. And I'm still working on, again, trying to figure out what's the best way to present this information in a virtual sort of way, as opposed to one-on-one. I know how to do it one-on-one with patients. How do you do this in a group setting virtually? There'll probably be some live stuff eventually as well. And then I have a website called gratefully.com. There's a 7-day gratitude challenge there that you can sign up for as well.
Awesome. And I know you have a YouTube channel. And what's the website address?
Gratefully.com.
Okay.
Yep.
Super easy.
Yep.
Awesome. Easy way to connect with you. So yeah, I'm looking forward to hearing more about the workshop and connecting myself. I think that will be very helpful just to kind of learn other ways that we can live gratefully well.
Well, again, I think, yeah.
Very
So
fitting.
your approach is very much aligned, with, what, again, I'm limited in as a physician, I'm obviously treating a lot of the physical sort of stuff, the mental health stuff. When I had the office, a lot of it was still, we had counselors and such in the office, doing that sort of stuff.
Yeah, awesome. Awesome. Well, again, thank you, Dr. Torelli, for joining us today. From making some of the things that seem so complex when you think about stress, when you think about overwhelm, burnout, anxiety, like all these other mental health things that also are showing up as physical health things because we're not addressing the underlying issues. And so I love that you broke a lot of these different complex things down and made it very simple for everyone to understand. So yeah, thank you so much, Dr. Torelli.
It's been an honor and a pleasure. Thank you.
Awesome. All right, guys, keep living, keep loving, and keep daring well. Take care. God bless.